So good morning. Today I'm going to talk about the bones of the skull. This lecture is divided into two parts. The objectives of these two parts lecture will be to learn the bone of the brain case, to learn the bones of the face and the palate, to learn the cavities of the skull and associated. The bone of the skull is very important because they protect the delicate structure that found in the head region. For example, our brain is found in the cranial cavity and is surrounded by the skull bone that going to protect this delicate structure. Also, the special senses organs such as sight, smell, hearing, equilibrium, and taste also all of them are surrounded by a bone to protect them. The second thing, they form the boundaries to the entrance of the digestive and respiratory system. As you know, that the respiratory passageway of the nasal cavity surrounded from outside by the bones, and these bones protect and also set the boundaries for these entrance. And it's similar for the digestive system. Also, skull bone provide the attachment to the facial muscles, and also we have the powerful muscle of mastication. So we have three functions: protection, set the boundaries, and finally provide the attachment for the muscles. Usually the skull bone is divided into two types. We have the facial bone and we have the brain case bone. The other name for the brain case bone, which is the neurocranium. Usually the facial bones form the boundaries of the nasal cavity, bony orbit, and the roof and lateral wall of the oral cavity. So anything that provide and set boundaries of the nasal cavity, bony orbit, and the roof and the lateral wall of the oral cavity, all of these bones are considered as a facial bone. For the brain case bone, they form the boundaries of the cranial cavity that enclose the brain and the meninges. So the area that surround the brain and meninges, these bones are the brain case bone. As I said, the other name for the brain case bone is the neurocranium. As I said, the facial bones form the boundaries of the nasal cavity, bony orbit, and the roof and the lateral wall of the oral cavity. Some parts and some bones from the brain case bones also help in the formation of these boundaries, and we are going to talk about them later. For the facial bone, usually they are classified into two groups. The first group, which is the paired bone, and we have the unpaired. If we have the bone in the right and left side, then we call it as the paired bone, and only if we have only one, we call it as unpaired bones. For the paired bones, we have 10 bones. The first one, which is the lacrimal, nasal, maxilla, zygomatic, incisive, palatine, trigoid, dorsal concha, ventral nasal concha, and we have the mandibles. For the unpaired, we have the vomer and the hyoid bone. So here, this is the area of the nasal cavity, and this is the area of the oral cavities. So the bones that set the boundaries of the nasal cavity, oral cavity, and this area here, which help in the formation of the bony orbit, all of these bones are considered as a facial bone, whereas the one that we have in the back here and usually enclose the brain and the meninges, we call it as the brain case bone or the neurocranium. So we can see here again these bones that found inside the cranial or rostral portion, So this bone that found in the rostral portion, this one here considered as the facial bone, and also this one, okay, that help in the roof of the oral cavity. All of these bone are the facial bone. The rest are the brain case. So we'll start with the first of the paired bones of the facial bone. The first one, which is the lacrimal, and the lacrimal is found in the rostromedial aspect of the bony orbit. So this is the area where we have the eye. This area here we call it as the bony orbit. So the most rostral and medial part, this is the lacrimal bone. In the center of this lacrimal bone, we have the fossa for the lacrimal sac. And usually the tears are collected in the medial of the bony orbit. Then through these fossa, it's going to be transmitted toward the nasal cavity through the osseous lacrimal canal. So this is the area which marks the beginning of the osseous lacrimal gland, and this area here is called the fossa for the lacrimal sac. So again, this one here, and in the center here we can see the fossa for the lacrimal sac. This bone, which is the lacrimal bone, articulate with the frontal bone, with the maxilla, with the palatine, and also with the zygomatic bone, and the one bone that are hidden. There's this bone here, which is the ethmoid bone, is a hidden bone. We'll talk about it later. The second bone we have, which is the nasal bone. So this one here, in the yellow color, this one here, we have the nasal bone, we have the right one, and we have the left one. Usually in the brachycephalic skull, when the dogs or a breed of dogs with a short head, usually the nasal bone is small. Usually from outside, these nasal bones are covered by skin, and from inside they are lined by the mucous membrane, which is the rosy pink layer that found inside our nasal cavity. We call it as the mucous membrane. Usually the nasal bone, you can see here, articulate with the maxilla, with the frontal, and also they articulate with the incisive bone. The third bone we have, which is the maxilla. Maxilla is the largest bone of the face. So the largest bone that's found in the face will be the maxilla. All this one, the red one here, all of this is the maxilla bone. Usually the maxilla with the incisive, they form the upper jaw. They form the upper jaw. Very important structure here found. There's an opening just below the level of the bony orbit. We call it as the infraorbital foramen. And this infraorbital foramen is the passageway for the infraorbital nerve, vein, and artery. Remember, always the artery, vein, nerve goes together. So whenever they go together, we call them the triad structure, which is the nerve, vein, and artery. And as I said, they move or exit through this opening, which is the infraorbital foramen. As I said, we have the infraorbital foramen, and usually there is a canal that extends from this area toward the bony orbit. This canal is called the infraorbital canal. As a canal, it has opening and we have exit area. The opening that found in the bony orbit is called the maxillary foramen, whereas the opening that found outside, we call it as the infraorbital foramen. So this one here will lead to the infraorbital foramen. This canal is found in the bone, so we call it as the infraorbital canal. As I said, this infraorbital canal is the exit for the infraorbital artery, vein, and nerve. So again, this is the area of the infraorbital foramen, and this is the area of the maxillary. And this one lead from here to here. This is the area of the maxilla, and also this is the cranial portion. This area also is part from the maxilla. See this one here, this is the maxilla, and you can see here all of this structure is part from the maxilla. As I said, the maxillary bone is the large of the facial bone with the incisive here. Both together, they form the upper jaw. There is an opening here in the bone of the maxillary bone. We call it as the entrance for the maxillary recess, and we're going to talk about this later. The fourth bone, that paired bone of the facial bone, is the zygomatic bone, and you can see this bone here. This bone is the zygomatic bone. As we can see, they form with the temporal bone. They form. See this area here, this is the area of zygomatic bone, and this bone here is the temporal bone. Together they form this arch area. We call it as the zygomatic arch. We call it as the zygomatic arch. And you can see here the zygomatic bone is very important because it sets the boundaries of the lateral area of the bony orbit. Usually this area here, we call it as the temporal process of the zygomatic bone, whereas this one here, we call it as the zygomatic process of the temporal bone. So we have temporal process of the zygomatic bone, and this one here, we call it as the zygomatic process of the temporal bone, and these together they form the zygomatic arch. Usually this bone here, which is the zygomatic bone, articulate with maxilla, and you can see it's articulate also with the temporal bone and lacrimal bone. So this one here, this is the zygomatic bone. As you can see, it's articulate with the temporal bone, articulate with the maxilla, and also articulate with the lacrimal bone. The fifth bone we have is the incisive, also the other name, which is the premaxilla, because it's just rostral to the maxilla, and usually it contains the 3 alveoli for the upper incisor teeth. So mostly the incisor teeth are found in the incisive bone, and usually this bone articulate with the maxilla and with the nasal bone and also with the vomer bone that we are going to talk about later. So this is the bone. All of this bone, which is the incisive, and you can see it carries the alveoli for the incisor teeth. So all of this structure here, this is the incisive and this is the maxilla, and that's why we call it the premaxilla bone. The sixth bone we have, which is the palatine. The palatine is the bone that forms the caudal part of the hard palate. As you know, the roof of our oral cavity, we have the hard palate and we have the soft palate. The cranial portion is formed from the incisive and maxilla, and the caudal part is formed by the palatine bone. So this area here where we have the bone, which is the hard palate. So this one here, this is the caudal one, which formed by palatine, and the cranial portion or the rostral portion is formed by the maxilla and the incisive bone. In this bone, we have very important structure, which is the palatine canal. Again, as a palatine canal or a canal, it has area in the beginning and we have the exit area. And usually the entrance area will be the caudal palatine foramen. And the exit will be this opening, which is the minor and major palatine foramina. So the palatine canal as a canal, it have a beginning and end. We have the area of entrance, we have the area of the exit. The area of the entrance will be the caudal palatine, and the area of the exit will be the minor and major palatine foramina. If we have a probe that passes from here, it's going to exit through this one, or this one, or this one. This canal, the osseous canal, we call it as the palatine canal, the beginning, which is the caudal palatine foramen, and the exit, which is the minor and major palatine foramen. This is very important structure because from this area here, as I said, that begins at the caudal palatine foramen and passes through major and minor. Sometimes they call it palatine or palatine foramen. So this is the area of the palatine bone, and this is the area again of the palatine with the minor and major uh, palatine or palatine foramen. From this area here, from these canals, palatine canals, passes the palatine artery, vein, and nerve. The seventh bone that we have, which is the trigoid is a small four-sided bone that have four sides. This one here, these together, these two bones are the trigoid bone, and usually they found and articulate with the sphenoid bone. The eighth bone that we have as bird bone, which is the dorsal nasal concha, and we have the number 9, which is the ventral nasal concha. This is the area of the nasal cavity, and usually what separates the nasal cavity, the right and the left, is the nasal septum. Inside the nasal cavity, we have the concha, and this concha extend from the nasal bone or from the maxilla. The one that extend, which is simple curved bone, this one here, this one is the dorsal nasal concha. And the one that are more complex, see here, consist of primary bone scrolls and secondary bone scrolls. This one here, this is the ventral nasal concha. This one start from the area of the nasal bone, whereas this one here start from the maxillary bone. So we have the dorsal nasal concha, we have one that found in the right side, and we have the other one found in the left side. The same for the ventral nasal concha. So on this one here, this is the bones. See this one here. This is the area of the dorsal nasal concha. And the one that's more complex, this is the ventral nasal concha. As I said, we have the dorsal, which is simple curved bone, whereas this one is more complex and it's formed from primary and secondary bony scrolls. This one starts from the maxilla, whereas the dorsal nasal concave starts from the nasal bone. So again, this is the area of the nasal septum. All structure we can see here, all of this is the ventral nasal concha. So again, we have the dorsal and we have the ventral. And at this area here, usually we have the nasal septum, which divide the right and left nasal cavities. Number 10, we have as a bare bone, we have the mandible. And the mandible, usually we have two mandibles that usually fuse in the rostral portion. So we have them like this, and then they fuse in the rostral portion. This area here, we call it as the mandibular symphysis. Usually the mandible consists of body, and we have the ramus. So the one that is horizontal, this is the body, and the one that is vertical, this is the ramus. And usually the body, they have the alveolus, the opening for these teeth. So it's easily to differentiate the body from the ramus. In the ramus, we have this area here, we call it as the coronoid process, which is the most dorsal, and this area here we have the condylar process, and in the caudal ventral edge of the mandible we call it as the angular process. And this area here, the notch, we call it as the mandibular notch. And this is very important because in this area we have the articulation with the upper part of the skull, and they form the temporomandibular joint. As I said, this is the area of the body, and this is the area of the ramus. Okay, as I said, the body, they have the alveolar border and bears the alveoli for the lower incisor, canine, premolar, and molar teeth. So this one here is the incisor, canine, and this one here the premolar, and the one that found in the caudal, which is the molar teeth. This area here, we have area of masseteric fossa, and this area here, there is attachment for the masseter muscle, which is a very important muscle for mastication. As I said, in the dorsal portion, we have the coronoid, we have the condylar process, we have the area of mandibular notch, and this is very important because they articulate with the temporal bone to form the temporomandibular joint. As I said, this is the area between the coronoid and the condylar process. We call it as the mandibular notch. And the one that's found in the caudal one, this is the angular process. Again, we have another canal here in the mandible. We call it as mandibular canal. Again, this canal have beginning and we have end, or area of entrance and area of exit. They start from the medial portion through a foramen, we call it as mandibular foramen, and they exit through the mantle foramen. So the mandibular canal begins at the mandibular foramen in the medial side of the ramus. It's not in the lateral, it's in the medial side, and they perforate the mandible rostrally and ends in three mantle foramina: caudal, middle, and rostral. And this is depend in the animal species. In the dogs, we have the three openings: the rostral, caudal, middle, whereas in the horse and dogs, only we have one foramen, and we call it as the mental foramen. The importance of the mandibular canal, it's a passageway for inferior alveolar artery, vein, and nerve. So we have artery, vein, nerve. And because it's in the distal portion of the skull, we call it as inferior, and it supplies the alveolus, or the area where the tooth are embedded, we call it alveolar. So we call it inferior alveolar artery, vein, and nerve. So if we, this is the area, this is the lateral, because we have the masseteric fossa, and these are the opening. We have three opening. We have rostral, we have middle, and we have the caudal. This is in the lateral, whereas in the medial we have this opening here, which is the mandibular foramen, and this here extend to reach this level here. As I said, this here we have the inferior alveolar artery, vein, and nerve. Now we are going to talk about the unpaired that only found as singles. We have the first one, which is the vomer. This is the area, the cranial cavity, and this is the area of the base of the cranial cavity. We can see this bone here, which extend obliquely from the base of the cranial cavity to the upper surface of the hard palate. This is the area of the hard palate. And this bone here extend from the base of the cranial cavity to the caudal part of the hard palate. This one here, this bone here, this is the vomer bone, and it's help in the formation of the nasal septum. And this bone here, as you can see, it's articulate with this bone here, which is the sphenoid bone. It articulate also with the palatine and maxilla and incisive, because this one here, see this one here, this is the area. This is the area of the palatine, it's the area of the maxilla, and the cranial portion, this is the area of the incisive. And this one here, which is the sphenoid bone. The last one we have as the unpaired bone of the facial, which is the hyoid bone. And usually we call it hyoid bones, and usually they consist of several bones, but still they are considered as part of the unpaired bone. This bone, which is the hyoid bone, extend from the mastoid process of the skull to the thyroid cartilage of the larynx. You see this area here, this is the area of the external acoustic opening, and this is the area in just caudal to it. This is called as mastoid process. So this one here, this is the hyoid bones, and they extend from the mastoid process, this is the area of the mastoid process, toward the thyroid cartilage. The importance of this hyoid bone to support and stabilize the tongue and the larynx. They help in the fixation and prevent the displacement of the larynx caudally, and from here also start the tongue. So this bone is very important because they stabilize the tongue and larynx. Usually this bone, which is the hyoid bone, consists of 9 bones. We have the stylohyoid, we have the epihyoid, ceratohyoid, basohyoid, and thyrohyoid. These two, and this is only one. So we have the total 9 bones, and the basohyoid is very important because it's a single bone, and from this one here the root of the tongue starts or attached. So this is the area, this is the thyroid cartilage, and this is the bone, the thyrohyoid, and we have the basohyoid, then we have the ceratohyoid, epihyoid, and the last portion, which is the stylohyoid. This one, as I said, articulate with the mastoid process, whereas this one here, the thyrohyoid, articulate with the thyroid cartilage of the larynx, and the basohyoid from this area here start the tongue. So the root of the tongue attached to the base